Hello and welcome. I'm Dr. McLeish. We're glad you're here. Thanks for joining us for a quick talk about how to deal with a world that can treat people who use drugs unfairly. This is the final part of our series where we're giving out information and tools that we hope you'll find helpful. Our focus today is on racism and how it can manifest in your everyday life, sometimes in ways you might not even notice. We'll also share some ways to deal with the problems it can cause. So what are some of the basics? We often think of racism as when someone says or does something hateful or harmful towards another person based on their race, but that's not all. Racism can show up in both big ways, such as not getting an apartment or a job because you look different, and in small ways, such as when someone watches you closely in a store because of how you look. It's how you might be treated differently just because of your skin or accent or your family history. Now, what are different ways that racism can appear in the lives of Black and Latinx people who use drugs? Historically, and even today, officers can label Black and Latinx people as dangerous or aggressive even when they're not, leading to them getting into trouble more often with the police. If they get caught with drugs, they might get punished more harshly, like longer jail sentences, compared to white individuals in similar situations. Family separations are also more likely to happen for Black and Latinx people who use drugs, which can really be challenging for your family and loved ones. Additionally, you might have no say in the rules and decisions about drug policies that affect your lives. When you seek medical or mental health care, the doctors or therapists trying to help you might not understand your culture, listen to your concerns, or they may treat you unfairly, which can make getting better even more difficult. Now, how can you know if you're dealing with the harmful effects of racism? Let's start with the emotions and feelings that can come up. It can make you really sad, angry, or hopeless. You may also feel like you're always worried, as if something bad might happen. So you're always on the lookout for trouble, which can become exhausting. Another sign is you might start avoiding certain places, people, or situations because of past racist experiences or the fear of encountering it again. Racism doesn't just hurt your feelings, it can also hurt your body. You might experience headaches, stomach issues, tense muscles, or even chronic pain. It can also make you feel like you're not as good as others and lower your self-esteem. Lastly, you may feel alone or disconnected from others because of the emotional toll of racism. You can develop a general mistrust of others, especially those from backgrounds linked to racism. This mistrust can negatively affect your relationships and social interactions. By recognizing these harmful effects of racism, you can take the first step toward healing. Remember, there's a reason you're here. There are people like us who want to see you well and safe. Now, what can you do to cope with these emotions? 1. Share your feelings with others. It's so important to express feelings so they don't get bottled up. By talking about our pain, we might find the strength to keep going. It may be hard to find a person or group that can listen to you, but it is worth the effort. Being heard and understood is important for healing. If you can, talk to your community health representative, family, friends, and loved ones who are open to talking about race and emotions. Feeling like you can't handle things, struggles to focus, or wanting to cry are all normal reactions to experiencing racism. However, keeping these things inside can make your mental health worse. It is not easy, but telling someone you trust about how you feel can make the sadness, anger, and pain feel less strong. You can even practice how to respond to racism with people you trust. Religion and spirituality can also be a way to find strength. If you have a faith or spiritual community, connecting with them, praying, and using positive phrases can really be helpful. What are some other ways to look after yourself? Number 1, don't watch too much news about racism and violence. It can be overwhelming and may make you feel worse. 2, make a list of things that make you feel bad or stressed and then make another list of ways to handle those situations. Number 3, pay attention to when you're feeling down or struggling because of these things we talked about before. If you can, take a break. Number 4, do things you enjoy and that make you happy. Do certain songs help? How about journaling or a fast walk in the park? Try to know the things that bring you joy and put them in your toolbox so that you can use them when you're feeling down. Number 5, check in with yourself and ask if you need help or someone to talk to. Number 6, if you or someone you know is in crisis or suicidal, call 988. That's a 24-hour emergency hotline for folks in distress. To summarize, racism is real. It comes in many forms, both big and small, affecting Black and Latinx people, especially those who use drugs. You are not alone in this journey, and there are people who care about your well-being, including us. It's normal to feel frustrated, overwhelmed, and angry. By sharing your experiences and feelings with people who understand and respect you, seeking support, and using healthy ways to cope, you can navigate the challenges of racism. If you do not have a safe space to talk about your feelings, ask your community health representative for a referral. They will help you find someone who understands and respects you. Remember, your presence matters, and you belong to a community. Lastly, as part of this program, know that we have mental health resources and professionals we can connect you with. Talk to your community health representative for more information. Thank you for your time, and stay safe.